A heart attack can be a very frightening experience, but in fact, tens of thousands of people survive heart attacks and go on to lead productive and enjoyable lives. Dr. Nael Aboul-Hosn, a cardiologist at Carson Tahoe Health in Carson City, explains what happens during a heart attack and how another can be prevented.
Heart attack is essentially poor blood flow to the heart muscle, and it involves the coronary vessels, or the main arteries that provide blood flow to the heart muscle. So essentially what happens is you may have a plaque in that region, and that region or that plaque ruptures, and subsequently you have poor blood flow to that area, causing poor blood flow to the tissue and essentially poor function of the heart in a heart attack.
Dr. Aboul-Hosn lists the possible symptoms of heart attack, which can differ between men and women.
The traditional symptoms of a heart attack involve substernal heaviness or pressure across the chest. This also can include radiation to the neck as well as to the left side of your arm. Many people do traditionally present with atypical symptoms, abdominal pain, right-sided pain. And so to say that it's just those, classic symptoms is incorrect, but the majority of them do present in that manner. But for women, these symptoms are not traditionally true. They tend to have sometimes more right-sided thoracic pains or chest pains, as well as maybe sweating and nausea as well.
Once at the hospital, diagnostic tests are done immediately.
So the initial thing that occurs when someone may be having a heart attack is to get something called an EKG, or an electrocardiogram. It is essentially the electrical mapping of your heart. And it shows us with typical fashion whether there is true injury to the area. More complex terms such as ST elevation is something that we traditionally see on an EKG, which usually acutely gets people involved to get them to the cath lab or a facility to get invasive treatment of that heart attack.
Treatment is determined by a proper diagnosis.
When someone has been diagnosed with a heart attack, we urgently take them to what's called the catheterization lab. And that's where a specific type of cardiologist called an interventional cardiologist performs what's called a coronary angiogram, or it's a essential mapping of the coronary vessels, the main arteries that supply your heart muscle. Once that's done, if they are able to locate a specific region of the heart muscle that is not getting appropriate blood flow, then a stent, which is essentially scaffolding, is taken down the coronary vessel and applied and opened up, and the blood flow is returned back to hopefully normal.
Patients begin cardiac rehab to get them back to living their lives.
Usually after a heart attack, there may be a little bit of apprehension on what people could do, and that's completely valid. They're uncertain of what kind of activities they're able to do if they're able to get back to where they were prior to the heart attack. And the real answer to that is that heart attack is one instance in your life. It is a speed bump, as that's what I tell my patients is, you got to get up and you got to go, okay? And so essentially what we do is we enroll them in what's called the cardiac rehab. And that is a 36-week session of not inpatient, but outpatient cardiac rehabilitation. And the most important thing with that is not necessarily the activity, but giving the patient back the confidence to get out there and do what they need to do to get back to normal.
Lifestyle changes can give the patient a better chance of a healthy heart and a longer life.
Preventative cardiology is something that this new generation of cardiologists is moving to. And essentially what it comes down to is treating some of the major cardiovascular risks that cause coronary artery disease. Best advice I have for someone who is trying to avoid having a heart attack would be to make sure that their blood pressure is within normal range, which by the newest guidelines is 130/80. Make sure that their sugar levels are well controlled. Make sure that they're getting enough exercise and activity, and also making sure that if they are using tobacco, they have a plan to quit using tobacco.